Today I'm bringing you a clinical case in which I treat pain using the balance method and Master Tung acupuncture. In this clinical case that I'm describing to you, I'm treating a male patient who is 32 years old, and he's a physiotherapist and also a Pilates teacher. He came into my clinic because he had a complaint of pain in his hip area, more or less around the area of bladder 53 to 54 on his right side. I decided to use the balance method to treat the pain. So as for step 1, we already have the bladder meridian as the affected channel. Step number 2, I decided to use system number 1, so small intestine channel. And for step number 3, choosing of images or mirrors, I decided to use an inverse mirror, which allows me to treat the hip area with his hand. And so I get to the area of the small intestine 3, or 2208 in Master Tung acupuncture, on the left side, so contralateral to the pain. And what happened when I needled this point? When the patient arrived at the clinic, he complained that he had this pain at a constant rate, so even not moving, the pain was there, but it got worse on certain movements. So I inserted the needle on this point and asked the patient how was the pain while he was standing still. He told me there was no more pain. I said, okay, so since he only had the needle in his hand, he could move freely, so let's try and do the movements that usually hurt. So he laid down on the treatment table and did some of the Pilates exercises that he complained that he couldn't do anymore because they hurt too much, and there was zero pain again. So I left the needles in for half an hour, and after the 30 minutes passed, I took off the needles, and we didn't book a second consultation, but I called the patient 4 days later, and he told me the pain had not returned. So it's one of those cases where we actually solved the problem with only one needle, which was the level of a master, as Master Tung talked about. So this is something that I'm sure the balance method users are already very familiar with, which is 1-2 needles and we can get rid of the pain. Of course, this was one of the best cases because the pain didn't even come back and we just needed 1 needle. If you like this kind of content, don't forget to subscribe to this channel. I'll keep posting at least once a week one new video of clinical cases or acupuncture related material.